Now we are going to discuss some interesting cases with you. So we start with the liver.
This case took place in Vienna airport. It was a 57-year-old male tourist, and he was on his trip to Croatia. His wife was asking for the airport doctor because her husband was getting more and more disorientated, and he had a blurry speech, so she was really concerned. The airport physician was suspecting a stroke and transferred him acutely to the stroke unit. Of course, CCT was performed, but there was no evidence of his ischemic disease. Take a look at the blood results. High ammoniac, PTT quite low, so we suspect maybe some chronic liver disease. And also in clinical findings, we saw signs of maybe chronic liver disease because the patient had an increased abdominal measurement and edema of both legs. So the next thing we did was performing an ultrasound examination. What would you think?
We can see the liver over here and this dark and hypoechoric area over here.
Nearly echo-free.
Nearly echo-free. I think it's ascites. The contour of the liver is not smooth. The echogenicity is inhomogeneous. So this is not a healthy liver.
Yes, you're right. Next picture.
Ooh.
Again, we see
ascites.
Ascites over here.
In the near field. The border is very irregular. We can't see the capsular anymore.
And you know, we could tell that the patient could maybe have ascites because his abdomen was quite large when he came to our ward. And do you think this capsular contour is normal?
No, of course not. There are all signs of
liver cirrhosis, yes.
Inhomogeneous parenchyma, irregular border, increased echogenicity.
But there's something else in this picture.
Okay, I see. Over here.
Some liver lesion over here.
A focal liver lesion in a cirrhotic liver.
What could it be? What do you think? You're right.
It's highly suspicious for hepatocellular carcinoma.
Again, this cirrhotic liver over here with irregular border. This dark area of ascites and this focal lesion, highly suspicious for HCC. Now we're in the left liver lobe, and please look closely. Maybe you can detect even some smaller lesions over here. So,
nodule, and over there's a nodule.
Again, ascites.
The organ already has shrunk, like you see in cirrhosis.
And so we got not only this one focal lesion, but also small focal lesions in the left liver lobe.
So we have got the final diagnosis: liver cirrhosis, HCC, and ascites.
So the three key messages out of this case are: patients with neurologic disorders can also have a chronic liver disease. Patients with liver cirrhosis and a focal lesion are highly suspect for HCC. And at least, ultrasound is a real powerful tool to detect all these pathologies. In this case, a 52-year-old woman was nearly dragged in by a friend of hers because she resisted to come to hospital. She had weakness over the last weeks and months and showed some strange behavior and was nearly paranoid, so I thought of a psychiatric disease. And she complained about mild abdominal pain, so we thought maybe we should perform an ultrasound examination, and this was the only exam she actually agreed us to do.
So when you see on the screen, there are some inhomogeneous areas over here, maybe a cyst or another focal lesion. We go on with the scan. Also in this area, there are some hypoechoic areas. Oh,
It's a big one.
this
Over
looks,
here.
oh, very serious.
Looks evil, I think.
Very bad over here. Irregular border, hypoechoic lesion in the liver. So it was a younger patient.
52 years old, yes.
He is highly suspicious of metastasis. Maybe breast cancer in this age, or cancer from the colon, stomach, pancreas.
We got a video clip over here, somewhere.
Okay. You see there are multiple hypoechoic lesions. And over here we see this halo, this very dark hypoechoic border around this lesion, which is also a signum malignum. There's the video.
There's the clip.
Okay, great. One over here. And some smaller. Okay. And also an obstruction of bile ducts in
Can be
this
seen
part.
over here.
So was a cancer known in the medical history?
No, but she didn't want to go to the doctor and hadn't seen any, I think, for about 10 or 15 years. Again, here a video clip.
So it's an advanced stage cancer in the liver.
Actually, Christian, you're right. This was liver metastasis of a breast cancer and also cranial metastasis. So this also explained the strange behavior and the paranoia of the patient.
So what do we learn from this case? We should hold the threshold for an abdominal scan very low. Sometimes we will be surprised what we find with abdominal ultrasound. A 35-year-old teacher was sent to our hospital because of a liver tumor. So we performed another ultrasound examination to take a closer look on this tumor. And we can see it over here.
Quite big tumor, I think.
It's a great tumor. There's an increased echogenicity in comparison to the liver parenchyma. And there are some Doppler images. Very intense blood flow in the lesion.
And around the lesion too.
Also a contrast-enhanced ultrasound was performed with a very intense uptake of contrast media in the first seconds.
Could you tell what the lesion was after SEUS?
No, there was no clear diagnosis, so the patient was sent to MRI, and MRI could not exclude HCC, so a biopsy was recommended. And
It was performed?
And performed, yes. And half an hour after the biopsy, the patient complained about abdominal pain. And another 10 minutes later, there were clinical signs of collapse. So we performed another emergency ultrasound examination. We see over here echo-free areas in the abdomen. So there was a suspicion of free fluid.
So what could it be after a puncture?
A bleeding, a severe bleeding. And we already have seen these great amounts of clotted blood in the abdomen. So the patient was sent directly to the operation theater.
And what did they see in the operation theaters?
There was free blood in the abdomen, about 700 milliliters of
Which is
free
quite
blood.
a lot. That explains her collapse.
And subcapsular hematoma of the liver, according to the puncture.
The bleeding could be stopped.
Yes, it was a successful operation. Patient was saved. And the result of the biopsy was adenoma of the liver. And we know adenomas are of a high risk of bleeding. Also, there are adenomas which can mutate to malignancies. So we have to check this patient in ongoing months again.
But in this case, performing emergency ultrasound saved the life of a patient.